Okay, hello there, how's it going? Welcome to the InnovationCell. I'm sure many of you watching this have probably actually already heard of us, and you've heard Carlos Rizzo, Neil Seaman, Alton Ing, Amal, other people kind of putting stuff online, Andrew Brown, Shaw. Got a shout out to so many people that have been part of this, it's hard to name them all, but what I'm trying to do in my kind of Asuma fellowship role is put stuff into a different kind of form and media. And one of the things that I love is video and sharing the ideas that I have through video. So I'm hoping that you can add a bit of value and give us feedback on some of the things that you'd like to see come out of the InnovationCell. What would help you to really kind of figure out what's going on in healthcare, how things are changing, and what you might be interested in. So the general overall idea is we're going to create an actual channel, and that way it kind of gives us a freedom to drop whiteboards on ourselves and do some other kind of fun stuff. But really what I kind of like about it is that it's not just one program yet. We can kind of see what you guys like and build other stuff into it. We can keep adding different shows and then see which programs you really like and then put more of that out. The kind of other thing that we're interested in doing is also getting other people who are interested in helping. Maybe if you have an idea for an innovative show and covering news or a new kind of topic in healthcare, maybe you can get involved in, and we can put that as part of what we're doing in the channel. So the kind of programs that I'm thinking about kind of unrolling or putting out there for you guys to kind of use or share, the things we're thinking about is innovators in person. We have a pretty strong network and access to equipment and things like that, so maybe actually doing interviews with interesting people in healthcare, get their perspective, get them to put away the job title and the kind of scripted stuff and really talk about what the challenges that they're trying to deal with are, what the kind of big successes have been, and forget just about the kind of publishing stream of thought, but what can they actually do to tell you about how they've been successful, what's worked, and what they could really use your input in. Two, innovation talks. Do you want to hear us starting speaker series or getting interesting people to just come in and give a bit of a lecture with Q's and A's, maybe we can webinar, do some live streaming with that kind of stuff. That's innovation talks. Three is innovation news. That's just maybe I can just go through the journals and pull out all the kind of really interesting cutting edge stuff. So instead of having to read a lot of RSS feeds, we can help you out and you can listen to the new and upcoming stuff in healthcare and within the province, the country, and just the world, so that you can understand and really think about how you can maybe affect what you do as a manager or a provider or someone that's in the marketing scene around healthcare, and really also allow you guys to submit the stories that you find interesting. Number four, ideas and review. Get some of these people that are really interesting, that have IT experience, that have management experience, provider, patients, and talk about the different ideas we actually have, because sometimes we think about them, but we don't have those people who can actually give us feedback on whether that idea might work. So maybe that's something, and we can dial in some people from the UK, from Canada, around the world to actually discuss these issues and how we can actually make them implementable, or talk about the timelines about how whether they're realistic or not, do a bunch of kind of fun stuff. Five, public ideas. That's something I'm hopefully starting later this afternoon, and will be up sometime very soon. And that's just going out there to the people. Forget Twitter and other things like that. I love it because it connects us, but sometimes we get a bit too attached to our device. So going out and finding ideas and letting you through Seismic or other kind of video comments, or just typing back kind of comment on that and sharing really the ideas and getting feedback on them. Because sometimes I feel like you get too caught up in our own social media crowd and we forget what it's like to breathe the fresh, clear air, or get the different perspective of other people. So how can we get them involved and really kind of exchange ideas and make stuff important happen and get feedback and spread the ideas as well. And six is Innovators Desktop. I know one of the big challenges for me when I talk to nurses, to healthcare organizations about these things is they don't get it. So maybe by doing screencasts and things like that, we can show you how we're pulling some of that data, or how we're using these tools, so that you can see how they might apply to your healthcare situation, or how you might be able to improve your health using these different tools. So those are the ideas, and we'd love to hear your comments and what you think. Tell us if we're going in the right direction, or if you have better ideas than us, or how it should be done, alright? Thanks a lot. Have a great day.